Hello everyone, this is your student Mary Snika and your as Pilas from BSN 12T Group 20. And today I am going to perform the parenteral drug administration return demonstration. So parenteral drug administration refers to any method of administration other than the oral means. However, it is most commonly associated with injecting straight into the body by passing the skin and the mucous membrane. So the most common routes for parenteral administration includes the intradermal, the subcutaneous, the intramuscular, and the intravenous route. So in performing medication administration, it is important to observe or to remember to observe and perform the 10 rites of medication administration to ensure patient safety and ensure that we give our client the most appropriate care. So for this video, I am going to perform 3 skills which will be divided into 3 scenarios. So the first scenario will include medication administration through the intradermal route. The second will be through the subcutaneous route. And the third will be through the intramuscular route. So these 3 scenarios have the same preparation phase, and so I am going to perform it at once to avoid making this video unnecessarily long. So for the preparation, before we actually proceed to the actual administration of the medication to our patient, the first thing we would want to do is to check the doctor's order and the medication administration record, or the MAR. So this is done so that we'll be able to identify what drug is to be given to our assigned patient. Also, we have to determine the drug's name, the dosage, the route of administration, and the time it is to be given. We also have to check the label of the medication against our medication administration record, or the MAR. This is to ensure that we give our or we ensure that we are going to prepare the right medication. Okay, so now in medication administration, it is important to remember the or perform the 3 checks. So what are these? So we'll have to check and read the label of the medication when it is taken from the medication card. Next, we'll have to read the label again before withdrawing the medication. And lastly, we'll have to read the label again after withdrawing the medication. So after doing that, we'll have to proceed with the preparation of the equipments needed to conserve time and energy. So the equipments include syringes. So I have here a tuberculin syringe, an insulin syringe, and a 5cc Gauge 23 syringe, a sterile water in the form of vial and an ampule, an aspirating needle, hypodermic tray, and a forceps, an alcohol, cotton ball soaked in 70% alcohol, and a dry cotton ball, and a waste receptacle. Now I am going to proceed with the preparation of medication from a vial. So, before I do that, I am going to perform hand hygiene to observe appropriate infection prevention. So, in a vial, if the medication still needs to be reconstituted, the vial would contain a powdered form of medication, and a diluent must be added into it. So after adding the diluent, we must mix it thoroughly by rubbing the vial in between the palm of our both of our hands like this. So after doing that, I am going to prepare my syringe. So I have here a tuberculin syringe. This is ideal for skin testing and intradermal injection. So I'm gonna open the packet of my syringe. So, it is important to remember that we can only touch the barrel and the plunger of the syringe to avoid contaminating the needle. Since this comes with a needle, I am going to loosen it up first so I can connect my syringe into an aspirating needle. So, I'm gonna put it here. So, now I am going to open my aspirating needle and then connect the barrel into the aspirating needle. So, ensure that the connection isn't loose, and then I am going to set it aside. Okay, so now I am going to open the covering of the vial. So, the rubber sheet is then exposed. So, I am going to clean it up using a cotton ball soaked in 70% alcohol. Okay, so now after doing that, I am going to get my syringe and uncap my syringe, and then I am going to draw air into my syringe. So the amount of air will be equal to the amount of medication that needs to be administered. Okay, so then I'm going to push the air into the vial. So pushing the air into the vial will prevent a vacuum from forming, and if you put too little air, then you will find it hard to draw out the medication. And if you put too much air, then the medication might be forced out into the syringe. So I'm gonna put the air or push the air into the vial. Then I am going to invert my syringe and do an exact amount of medication that is needed. Okay, so now if you see air bubbles inside the syringe, then you can lightly tap the barrel, and then by that you can expel the bubble. So now I'm going to remove my aspirating needle and put my syringe in the correct size needle. So next, I am going to place the syringe with a medication tray, and then I am going to write the medication ticket so that we won't forget what medication it is and the dosage and who it is assigned to. So now I'm going to proceed to the preparation of the medication in an ampule. So I have here a sterile water ampule that will serve as a medication later. So what I am going to do first is to perform a hand hygiene. Next, I am going to prepare my syringe. So I have here a 5cc Gauge 23 syringe for my intramuscular injection. So I am going to open the packet, and since it comes with a needle, I am going to loosen it up first so I can connect my aspirating needle. So an aspirating needle will help reduce the risk of having glass inside the medication. So now I'm going to open my aspirating needle. And I am going to connect my syringe into the needle and make sure that the connection isn't loose, and I am going to set it aside. Okay, so now with an ampule, what we would want to do is to afflict the upper stem of the ampule a couple of times first. Okay, so after doing that, we are going to get a gauze or a cotton ball. So I have here a cotton ball. So with a cotton ball, hold in between the fingers and the neck of the ampule. Then break the ampule away from you and away from the other people just for caution. Okay, so we're gonna after doing that, we're gonna discard the broken neck of the ampule into waste receptacle and set it aside. So now we're going to get our syringe and draw the exact amount of medication needed. Okay, so after doing that, we have to connect the syringe into the right size needle. Then I am going to place this in a medication tray. Then I am going to write the medication ticket. So we have to remove the aspirating needle and connect the right size needle for it. So now I am going to do the intradermal administration. So intradermal administration is the introduction of a small amount of solution into the dermis or the layer beneath the epidermis. So the first thing we would want to do is to perform hand hygiene to deter the spread of microorganisms. So after preparing my medication, now I am going to head over to my patient's room. I am going to introduce myself to my patient, verify my patient's identity, and explain the procedure to my patient. So good morning, ma'am. I'm your student nurse, Nicalia Lucas Villa. So may I see your resident, ma'am? Please state your complete name and your birthday po.
I'm Mariel Estelio and my birthday is October 29, 2005.
So, how would you like me to call you po?
Mariel.
Okay, so today, Mamaya, I will be doing a penicillin skin test. So, what I'm going to do is to inject a small amount of penicillin into your skin in your forearm to check if you are allergic to it or not. So, ma'am, this injection will provide a small wheal, or sometimes we call it a flap, in your skin, and you will feel a slight prick when the needle enters your skin. Will that be fine to you, ma'am? Okay, so I'll just close the curtain and to provide you privacy. So after doing that, we'll have to assist the patient in a comfortable position and then select the site for injection. So ma'am, I will leave your arms here. So are you comfortable po? Okay. So now we'll have to select the site for injection. It should be 3 to 4 finger widths below the anticubical space and 1 hand above the wrist. So we should also avoid using the site that are inflamed, tender, swelling, and have lesions. Also, we have to apply clean gloves. So I'm just gonna wear my gloves. So after that, we have to clean the selected site for injection using a cotton ball soaked in a 70% alcohol. So we have to start in a circular motion from the center outwards. So we have to throw this. So after doing that, we have to prepare our syringe for injection. So we'll have to remove the cap of the syringe while waiting for the antiseptic solution to dry. So if there are some air bubbles in the present in the syringe, we can tap the barrel and remove the air that is trapped to the syringe. Then we should hold the syringe between our thumb and 4 fingers like this, and then hold it almost parallel to the skin surface with the bevel needle up. So now we're going to stretch the skin, and then now I'm going to advance my needle into my patient's skin and then push the medication in slowly until a wheal will form in the my patient's skin. So the presence of or the appearance of wheal indicates that the medication has entered the area between the intradermal tissues and that the medication has been correctly placed in the dermis. So, tusok na po ako, mama. Also, we have to withdraw the medication same manner or same angle it was inserted to minimize the patient's discomfort and minimize the damage to the tissue. Okay, so also we have to remember not to massage the area. So I will lightly tap it with the cotton balls. Then we have to discard this. Then we will have to remove our gloves and discard it in a receptacle and perform a hand hygiene. So then we have to draw a circle around the wheal to observe the redness or the induration of the hardening. So we should use a blue or black ball pen because red pen will interfere with the reading. Okay, so then we have to document all the relevant information. We have to record the testing material given, the time, and the dosage as well as the route. So now, ma'am, we are done. Are you feeling alright? So we will learn the result after 30 minutes. So I'm just gonna head out first so that you can rest and make sure not to massage the area, okay? So if you need anything, just don't hesitate to call me so I can go back and attend your needs, okay? Then proceed to the documentation process of the procedure after 30 minutes and ensure to come back to the patient's room to interpret the results of the skin test. So now I am going to perform the subcutaneous medication administration. So subcutaneous administration is the introduction of a small amount of solution into the adipose tissue between the skin by means of syringe and the needle. So after preparing the medication earlier, I will just head over to my patient's room, introduce myself to my patient, verify my patient's identity, and explain the procedure to my patient, and ensure that my patient's privacy as well. Good morning, ma'am. I am your student nurse, Nika Andrea. So, can I see your wristband po? Please state your complete name and your birthday.
I'm I'm Maria Estario and my birthday is on October 29, 2005.
Okay, so how would you like me to call you po, ma'am?
Maria na lang.
Okay, so today, Ma'am Maya will be doing the administration of your insulin. So, insulin will help your body control your blood sugar as you have a type 1 diabetes. So, I'll be injecting your insulin in the subcutaneous layer of your skin over your abdomen. So, this medication will lower down your blood sugar. Will that be alright?
Yes.
Okay, so I'm just gonna close the door so that no one from the outside will disturb us while doing the assessment, okay? So after that, we have to assist the patient in a comfortable position, then select the site for injection that is free of lesion, free of inflammation, swelling, and tenderness. So ma'am, I will just expose your abdomen po. Then I will lift your clothes. Okay, so we have to also to select the site that is free of tenderness and swelling. Then we'll have to apply a clean gloves. So after doing that, we are going to clean the selected side using a antiseptic swab, starting from the center going outward. And we're gonna dispose this one. Then we're gonna prepare our syringe for injection. So we're gonna uncap the syringe and pinch the skin, hold the syringe as if you are holding a dart. Then inject the medication into the patient. So we are going to inject the needle at a 45 degree angle. So I'm gonna inject now. So now I'm going to release my pinch, then support the syringe, and then I'm going to push the medication in. So after doing that, I'm going to remove the needle, same angle that it was inserted. So now if bleeding occurs, apply pressure in the site with a dry sterile gauze until it stops. Then we have to dispose the used syringe in a waste receptacle. Okay, ma'am, so now that we are done, are you feeling alright? Okay, so that's good to hear, ma'am. So I'm going to head out first. So if you need anything, just don't hesitate to call me or use your call button so I can go back and assess or attend your needs, okay? So after doing the procedure, discard the gloves used and perform aftercare of the equipments used. So we're gonna throw this and perform hand hygiene. And we have to assess the effectiveness of the medication at the time it is expected to act. Then we're gonna proceed to the documentation process of the procedure. Now I'm going to proceed with the intramuscular administration of medication. So intramuscular administration is the introduction of medication deep into the muscle tissues where there is a large network of blood vessels that can absorb the medication readily and quickly. So after preparing the medication earlier, so I am going to head over to my patient's room. I am going to introduce myself to my patient, verify my patient's identity, and explain the procedure to my patient. Good morning, ma'am. I'm Nika Anrialu Esquinas, your student nurse for today. So may I say your respect, ma'am? Please state your complete name and your birthday.
I'm Maria Estario and my birthday is October 29, 2005.
Okay, so today, ma'am, how would you like me to call you po?
Maria.
So today, ma'am, I'll be administering you the medication that has been prescribed by your doctor. So its drug name is cortisone. So it is an anti-inflammatory which will help you with your tendonitis. So I'll be injecting this medication in your shoulder. So will that be alright? Okay. So first, I will perform a hand hygiene to prevent infection. So I already prepared the medication from the vial earlier, so I'll just close the door so that no one from the outside will disturb us while doing the procedure. So I'll just close this curtain box and then I'll just close the door. So after explaining the procedure to the patient, we'll be proceed with the assisting the patient in the most comfortable position for her and select the site for injection. So, ma'am, can you I'll just expose your shoulder lang po. So, are you comfortable po, ma'am? Now, for intramuscular injection, we have to select the site that is free of lesion, free of inflammation, swelling, and tenderness. So, we have to apply clean gloves. So after doing that, we'll have to clean the site of injection using an antiseptic swab or a cotton ball. So I have here a cotton ball starting from the center, going outward, and then discard this used antiseptic cotton. So from the inside, outside. So I'll discard. After that, we'll going to prepare the injection. So we're gonna get our syringe and uncap the syringe. Hold the syringe using our dominant hand. So since I'm right-handed, I'm gonna use this one. So we're gonna hold like a dart. Then using a Z-track method, we are going to advance the needle into the patient's skin. So we are going to advance the needle into a 90-degree angle. And then after doing that, we are going to aspirate. Okay, ma'am. Magtusok na po ako. And then we are going to aspirate. So if there is a blood that will appear on the plunger, we are going to remove the needle and discard the syringe and get a new one. And then if there are no blood, we can insert the medication or we can administer the medication. Okay, so since there is no blood, I'm gonna administer the medication. Now we're going to remove the needle from the patient's body. Same angle as it was inserted, then apply pressure into the injection site. Okay. So we have to discard this in the waste receptacle to avoid needle prick injury. Okay. So now, ma'am, that we are done with your injection, are you feeling alright? Okay. Since we're done, I'm just gonna head out first, so you can relax. So if you need anything, just don't hesitate to call me. Okay. So I'm gonna head out first now, ma'am. After doing the procedure, discard the used gloves and perform aftercare of the equipment used. And then we have to proceed to the documentation process of the procedure done, the time of administration, the drug name, the dose, the route, and the client's reaction. Then we have to assess the effectiveness of the medication at the time it is expected to act.